welcome to another episode of A Seat at the Table, hosted by yours truly, Karl Singleton. Uh, Here at A Seat at the Table, we thrive ourselves on making sure that we bring decision makers or those with connections to those decision makers to this platform so that we can allow our viewing audience to marry our needs with resources, viable resources that are out there. Today, as we very well know, we have been experiencing and living through and thriving through a pandemic that none of us have experienced before. We have had several conversations around and about the COVID-19 pandemic, vaccinations, etc. To be clear, we have advocated from this platform that those who are in who desire to have the vaccine, we have ensured that they had outlets in which they could go and secure that vaccine for themselves and their families. That is something that I myself continue to make readily available to those that are desirable to have it. It is something that I believe personally that we should definitely take full advantage of, if not for us, but for those around us and our loved ones, and in particular those young people who aren't age eligible yet for the vaccines. And so, with that being said, we are now going to go into yet another opportunity for our viewing audience and listeners to engage with professionals, not only those of us who are lay persons who do our individual research, but those individuals that do this for a living, that are certified doctors, that are recognized doctors, MDs. And for today's show, I did not necessarily state these doctors' affiliations because they are free to talk. They are welcome to talk freely without being tied to any particular institution. Their credibility speaks for itself. And so, without any further ado, what I would like to do now is introduce our panelists, as I'll call them today, that we have joining us to have this robust conversation around COVID-19, our urban and particularly Black communities in the vaccine. Um, there may be topics that come up as we continue along this conversation that come in through our viewers, and so they are all welcomed. But as I've said to the professionals that we have during our pre-meetings that we've gone over, they are not here to be tied down 100%, with specificity to the statistics or to answering Facebook questions that are or theories that are out there that aren't rooted in science. And so, one thing I'm a firm believer in is science and growing with science and not necessarily going with it unquestioned, but at the same time respecting the science and recognizing that it is what it is at this current moment. So, with all that being said, what I'd like to do is first bring to the forefront Dr. Julianne Adams, who is a leading voice for women's health and an OBGYN. We have with us as well Dr. Karima Fitzgerald, who specializes in critical care medicine, general surgery, and traumatic surgery. We have Dr. Ife Nduku, whose area of expertise are focused in and is rooted in internal medicine. And last but surely not least, we have Dr. Angel Schuster, who brings a wealth of knowledge from the pediatric emergency medicine perspective. And so, again, I'd just like to thank all of you for joining us again and continuing our conversation and welcoming Dr. Schuster for the first time, but it won't be her last time. And, just that whole familiarity around the conversation with COVID, where we were, we in particular as a global we, and then narrowing it down to we as Black people in particular, and more specifically in urban communities. So, what I first like to do is I'll ask Dr. Burke to give a brief intro, and then we'll move on to Dr. Fitzgerald. We'll then go on to Dr. Nduku, and then, of course, Dr. Schuster. If you wouldn't mind just giving a brief intro. And again, thank you for joining us.
Sure. Thank you again, Karl, my classmate, for having me. I am honored to be here. I am an OBGYN and I practice in Metro Atlanta, outside of Atlanta, in Commerce, Georgia. I have been out of Harrisburg for 30 years this year, celebrating our high school reunion this year, class of 1991. I'm so glad that you asked me to join you again because today um, I'm coming to you with a couple of hats on here, not only as a physician who has been trying to convince my patient population to get vaccinated, but now I'm in another fight for my for my family, not only to get vaccinated, my patients, my family members, but also for my children's school to see the light and mask up. I have children who are under the age of 12 and are unable to be vaccinated. Yet the mitigation strategies at our school do not allow for all of the students, especially those who are unable to defend themselves with the primary prevention with the use of vaccination, will not even encourage everyone to mask up. So I have a lot to say tonight. Thank you for having me.
And everything you have to say is indeed welcomed. Uh, Dr. Fitzgerald, please.
Thank you again for having me, Karl. It's an honor to be back. My name is Karima Fitzgerald. I am a general surgeon and critical care fellowship trained. I practice trauma, acute care, and critical care surgery. I've recently had the opportunity to practice some global medicine, where the pandemic is extremely hard hitting our communities in certain areas. And so, having had the wonderful opportunity to be able to care for those patients, their families, and also for some of my colleagues in those spaces, I have a lot to say about where we stand as a group of people, as a community, in terms of getting vaccinated and how it's definitely affecting us, in addition to the effects that it's had on us here in Pennsylvania. So I really appreciate being able to join this group, and I am looking forward to the conversation.
Thank you very much. Dr. Nduko, please.
Well, thank you for having me back. I guess this is my third time on this panel, and I'm glad to be here. So my name's Ife Nduku. I am a internal medicine physician, specifically trained and focused in hospital medicine. So I exclusively work in the hospital. So as I've been saying, the times that I've been on this, on this program, is that I see firsthand how sick these people get, how sick these patients get, and now we're seeing a very different thing. They're very sick, but it is a lot, and primarily, I shouldn't say a lot, it is primarily those who are unvaccinated. And now that we have this Delta variant, it's even scary. It's scarier in the sense that you have vaccinated people who are protected, but they can still infect other people, particularly the unvaccinated. And it's having an effect on our numbers. Our numbers they're shooting up. So I'm glad to be back. I'm glad to be here to have this discussion, and I want to strongly encourage everyone to get vaccinated. And we talk and give you some just real answers if I can. So I'm glad to be here. Thank you for inviting me.
Oh, definitely. Thank you for being here. Certainly not last, but certainly not least, Dr. Schuster.
Hi, I am so excited to be here with the other professionals, two of which I have been engaged in other conversation with. So I'm just excited and honored to, be a part of this conversation. So my name is Angel Schuster. I'm a pediatrician, and I am a fellowship trained children's emergency physician. I only treat children. I will also care for some young adults, usually like to the age of 21. I have the perspective of also being a mother of 4 children, 3 of which are all 9 years old, one who is 2.5. And so I feel like I also have a lot to say. There is so much information about the vaccine. I am a definite advocate of getting the vaccine, but I'm also an advocate of people keeping their families safe. I try to educate as much as I can, the parents of my patients, the guardians of my patients, grandparents, aunts, uncles. And so I feel like I have a lot to say. I also share the struggle of making sure that my children, my 3 older ones, when they go to school, that they are they're in a safe as an environment as they can be in medically. And I also, when I go to work, I really understand the struggle of parents who are just trying to work, care for their children, keep them healthy and safe. And so I just try to do the best I can with education and advocacy. So thank you so much for inviting me.
Definitely. So we'll stay right with you on that note, and everybody can hit, whether you're a parent or not. Everyone can hit on the topic of children's safety, because we're convincing or trying to convince you. Well, let me just go back. You all, as the professionals, are attempting to convince an adult community to trust medicine, to trust the vaccine, independent of their personal questions and or concerns or agendas, for that matter. Um, how do you get this message across to those parents, those adults in the communities, um, without scaring them? And one of the ways I say it is, have said it in the past, is, if not for you, do it for someone else. So we'll stay right with you, Dr. Schuster. Being a pediatrician and talking with these parents, these adults that are coming, that you're engaging with, that may be hesitant about the vaccine, what is it that you say or do, or how do you try to coach them into making sure that they are basically protecting themselves and their communities, ultimately for their kids?
So the tactic that I have taken is really just getting to them on a personal level. I have no issues letting people know that not only am I, their child's doctor that they're seeing in emergency department. No one wants to come to the emergency department, just for fun. So they come to us when they need us, and so there's a vulnerability there for our patients and their families. And so I also have no issue showing them that I am also vulnerable. I will educate them about the vaccine. I will let them know that I'm, again, the mother of, 4 children. And I understand when they have to come in just because they need a daycare. No, they just need a COVID swab, or they're concerned about their child, or the child had an exposure, or, the guardian or parent has had an exposure. My biggest thing that I'm focusing on right now, because I am seeing a lot of parents who absolutely have chosen to vaccinate themselves. But there's a lot of families who have younger children who are not able to get the vaccine yet, because the cutoff is 12 years old. And so I am telling them, no matter what you see on the news, or what your neighbor or a relative is telling you, please make sure that you are protecting yourself and your children. If you feel like you still want to wear a mask, despite whatever the latest mandate says, you are not alone. And I just really try to help people feel empowered, but on a personal level, to let them know that you're not just talking to, someone who is coming at you from a medical perspective, but also that, we are real people too. And we have definitely dealt with the struggles of COVID on a personal level.
That's perfect. That's a great transition over Dr. Burke. You just led off with that. The importance of masking up, and honestly, basically sending, your personal children and children overall back into conditions that are questionable, for lack of better terms, at this point, especially with the exposure, the increase with the Delta variant. Speak a bit to that perspective where you were leading to earlier.
Sure. So, I'm going to start by saying that my 8-year-old said to me in the car last weekend, the school started for my children on Monday. And he said, Mommy, I felt very safe despite the fact that there's a pandemic going on. They always just say, despite the coronavirus. And I said, well, why? And he said, because we've been home. So basically, I have sheltered my children since March of 2020 20. Now, what I did decide to do, so last year, let me say, I pulled the boys out of their school and had a wonderful homeschooled experience with a virtual teacher. She taught my then second grader and my kindergartner virtually. Well, the older one, the 8-year-old, was by himself. It was just, he was on a Zoom with his teacher, and my kindergartner at the time had one classmate. And they survived it. They did well. But I recognized that socially, there was some problems there. My older one had a bit of anxiety. I was concerned in the beginning. He was having crying spells. So I say that to say that's why I initially decided, okay, the vaccine is here. All the adults who can get vaccinated have been vaccinated in my household. The school, they mandated masks last year, and it wasn't until less than 2 weeks before the start of school that they announced that it's now optional. The importance of masks, first of all, in that age group, and again, I see women and mostly adult women, but the importance of masks is to decrease spread. It's not just for the person wearing the mask, but for the people around them. So if there is an exposure, there's less likely it's less likely that you're going to pass it on. So masks are vital, especially in the ages of our children. For those of us who have kids who are younger than 12, and we all know, you go into the store and you see that people are not wearing their masks appropriately. But we're saying in general, overall, the more of us that are masked up, the less likely to spread any viral particles. So especially with this Delta variant is something serious. I think most of us have heard that it is just as contagious as the chickenpox. A lot of people don't even really get what that means because they didn't live through chickenpox. Chickenpox vaccine, I want to say, came out in 1992. So there's a generation who they don't really understand what the chickenpox like. Most of us don't know what polio really entails, except we learned it in school. But the chickenpox, it's said to have been able to, if I had chickenpox, if we were sitting in a room, 90% of the folks in reach of me will get it. That is how virulent this particular Delta variant is. So masks are exceptionally important as a part of the mitigation strategies.
I think that's great right there. That just as a part of the mitigation strategy, I think that's key to hone in on. Dr. Fitzgerald, you were talking from a global medicine perspective and some things that you've seen. So if you wouldn't mind jumping in.
Sure. So I've had the opportunity to practice medicine in the US Virgin Islands recently. And the population there, though the islands are small, the rate of spread is very high, even among the healthcare providers. Many of them still don't believe in the vaccination, and even with it being such a small island and them caring for critically ill COVID patients, many people are still extremely reluctant. And there's recently been an outbreak in certain areas where people who initially were negative when they entered the hospital, they seroconvert and now are positive. And it's becoming more of an issue, and it's because of the prevalence of the Delta variant. I think that one of the things is that when you have certain areas that are highly populated by people who have been essentially done wrong by the field of medicine throughout the course of the years, and it felt like guinea pigs more often than not, that hesitancy to jump on board with a new form of medicine or something that could potentially save your life is still questionable. And I think the only thing that we can do is continue to educate. The thing that just kind of hurts to see is that so many of the providers are still on that bandwagon as well. And I think the unfortunate fact is that more and more people are going to have to be critically ill from the virus in order for people to realize how serious it is and how important it is to participate in the vaccination process. I think that A lot of people are trying to do the education and trying to encourage more and more people, but so many people are still afraid, especially since many of the healthcare systems are not necessarily as adept at taking care of patients as we have been in the United States. One of the things that we also were confronted with very early on is the shortage of resources. And I think as more people hesitate to get vaccinated, we'll start to see that again. And that's the fear, especially as mask laws are lifted and people are less vigilant about hand hygiene and masking up. I think that we'll see more critically ill patients, and then the hospitals will get overflowed with multiple sick patients and not have enough resources to provide them adequate care. The other thing that we're starting to see secondary to the increase in the numbers and the Delta variant is that we're starting to have a shortage of healthcare providers because people are getting burned out from the number of hours, the number of people who've gotten furloughed, and then just overall taking care of so many critically ill patients. So it's not just a local pandemic. This is truly a global pandemic. And I think that all we can do at this point is continue to encourage people. And I don't know how else to stress it, but I think as people start to see more and more people who are close to them who've refused to get vaccinated suffer from the severity of the Delta variant, then maybe they'll take it seriously, maybe they won't. But it's very difficult to actually understand the psychology behind it, especially when you have people who are close to you who constantly tell you the importance of maintaining social distancing, maintaining the mask laws, and maintaining the vigilance, and being able to participate in something like getting a vaccination for something like this could change the face of this whole process and actually allow us to get back to a sense of normalcy, very similar to the polio vaccine, measles, mumps, and rubella. We haven't seen cases of that in how many years? And that's because of vaccination. So they do work. So it's really important for people to start believing in that again.
As a hospitalist, as you were saying, just talk about some of the things that you've seen, that you've been experiencing, and how you've been, I guess, making this transition with your patients, down to almost only arrive back at another battle that we're calling now the Delta variant of this COVID-19.
Yeah. So the importance of the vaccine is significant, right? So it wasn't just that we had vaccines, we were wearing masks, right? So you had patients and you had people washing their hands and preventing spread of infections, of disease. So think about some of the other viruses. So RSV or flu or parainfluenza viruses. They happen every year. But this year, those numbers were so very low because of COVID was the dominating disease, but two, because people were washing their hands and wearing masks. Now, the vaccine helped stem and prevent people from getting infected, right? But it also helped prevent people from getting so sick if they did get COVID that they needed to come into the hospital, or they needed to be in the ICU, or they needed to be on a ventilator, right? The vaccine is extremely, extremely, extremely effective about preventing severe disease. So our hospital numbers went from astronomical numbers in January and February to minimal numbers. We got under 10. We got under 5. We had periods where we had 1 or 2 patients in the entire hospital. It was nice. It was a relief in many ways. But when the country, the nation, the state, the region started opening back up, and then the CDC had recommended that we could stop wearing our masks for vaccinated people. Well, unvaccinated people weren't wearing the mask. And then the Delta variant happened. So even if you had vaccinated people who weren't wearing the mask, because of how very transmissible the Delta variant is, and it is extremely transmissible, twice as transmissible as the previous variants, and some suggest more. It resulted in that even though you're vaccinated and you may not be hospitalized, it does mean you could pass it on. So if you're vaccinated and you're passing it on, you might be passing it on to other vaccinated people who could pass it on, or unvaccinated people. So if you're unvaccinated, that means you could end up in the hospital because a vaccinated person passed it on to you. And over the last month, our numbers have been rising slowly, steadily, but surely. And we've reached our highest numbers just today. I'm coming from the hospital, right? Our numbers are higher than they've been. Sorry, the highest they've been since back the height of the pandemic and hospitalizations. And over 97% of the people who are in our hospitals are the unvaccinated, right? And our question is, are they getting the infection from other unvaccinated people or vaccinated people? The problem is it doesn't really matter because they're not vaccinated. Now they're unprotected. And now because they're unprotected, they can get sick and they now can die. The vaccine is so important. Now, to piggyback off of what Dr. Fitzgerald says, there are many physicians who were traumatized by everything they went through over the last year and a half, that some of them are like, well, I can't go through that mentally again. And that's a fear, that's a concern that these numbers are rising. They're not plateauing off, right? Generally, you look for a plateau, then with the hopes that you change in behavior, change in concern will result in a downward trajectory. But we haven't even hit our plateau. Our numbers are rising. And the concern is that a lot of these numbers tend to lag behind. So we have people going to concerts, going to movies, going to shows, wearing a mask, not wearing a mask, and this Delta virus is spreading. So the problem with that is that if you have spread, people being lax, you start seeing the diseases that we weren't seeing before on top of COVID, and then you have occasional breakthroughs, right? They're rare, but they happen. You really need to wear a mask, and if you can, get vaccinated. So it's so very important because I'm seeing the hospitals fill back up again. I'm seeing the numbers I'm seeing the numbers rise and be a significant source of strain on our people and the people who care for you. And if you lose the people who care for you,
right,
I don't know what you're going to do then.
And that's the piece. I thought Dr. Fitzgerald touched on something. That burnout is key. And I'm looking, and yeah, there's teacher burnout and there, but this first responders burnout, or this piece about those that are in the medical field, really, looking and facing death, in essence, facing death daily as you go in to perform your professional duties and your personal responsibilities, for that matter. Most of you done this, you made a personal choice to continue to be involved in this field, to then have the other side, will say, come back with why they're not going to be vaccinated, has to be, doubling down in a way where is nearly unforgivable, we'll say. And those are my words. And what I look at is, maybe what we need to do is go back, because the message from the onset was hijacked, because the messenger was unbelievable, in terms of the original administration that this COVID had come under, started protruding through, we'll say. And with that being said, we are now at a point where nothing is 100% guaranteed, which we all know. There's no 100% guarantee of anything, except for you're going to pay your taxes and die. That's it. That's the only 100% that's going to, be applied to us while we're here on Earth. But what we're saying is not that the vaccine is 100%. What I'm clearly hearing is that the vaccine is not agreeable. It is not 100% preventing you from getting the COVID. It is a stopgap, hopefully, from you getting on the ventilator and subsequently dying. Let's say that again. It is not an end all be all cure all. It is a stopgap, hopefully, so that you do not end up on a ventilator and or dying, which we've known, and I've had personal friends, personal that I consider family, die from this disease, from this virus. So let's talk about the COVID vaccine and what it is, not what it isn't. What is it? Meaning, it is a vaccine that is out there that is a preventative measure, not a cure for COVID. It is a preventative measure. So anyone at this time, feel free to jump in.
I'm going to jump in because I think you've hit it spot on. It's about the messaging, but because I'm going to be very transparent. I think I said this the last time around. I was a hesitant participant in the beginning, it was like, oh, when my patients ask me, well, Dr. Bird, when that vaccine comes out, are you going to get it? I said, oh, I'll eventually get it, but I'll let you go in front of me. You know, I would tease about that until I had to pause and say, okay, let me read, let me understand. And so people still consider, oh, it's new, it's experimental. They still use that term. And so this is what I tell a lot of folks every day. These are everyday conversations. That also adds to the burnout because it's just repetitious. But I do say this. Let's think about the algebra equation. AX squared plus BX plus C equals 0, something that kind of was in the back of my head, right? That's not a new equation, but every day when the teacher presented the test to you or your homework assignment, you got new variables to put into that equation. The mRNA vaccine, once again, did not just get discovered in January 2020. It's been around, I believe it was 2003 was the first introduction of the mRNA technology. But what happened was in the original SARS and MERS and whatever else they used it for, it got shelved, right? So that formula wasn't necessarily needed because those, viruses went away, let's say. But now they dusted it off the shelf and just inputted the new variables into that equation or into that formula. So I always tell patients that, and it's like a light bulb, like, oh, it's not new. I said, yeah, I really wish, and maybe someone else on the panel knows this information. I wish we could go and find those few thousand people who got the original mRNA vaccine and see how they're doing. Did they have children? Did they grow a third arm? Did that, what happened to them? Just so we can debunk some of that whole new experimental, I'm not going to be a guinea pig. I haven't heard much about the Tuskegee experiment. I think that
that's going. I think we've beat that back well enough. I think people recognize that we were not given anything, and that hence was the issue after being given something.
So, right.
Preventative. So, yeah. So that one thing that, and Brother Washington brings it up in our comment section. So there is the concern about people who've chosen to get both shots. However, now the question becomes, things are suspect now because now we need a booster. So talk about the relevance of this booster shot, and Dr. Schuster, or whoever, just go ahead. We're all balanced.
Iffy, I'm gonna let you take that one because you even educated me about the vaccine, so I think you're more qualified to speak on that.
Thank you. No one's ever said that to me. No, I'm joking. But no, no. So it's important to understand why we need the booster shot. So yes, the vaccine, it stimulates your body to produce the antibodies, so it will protect you from severe disease. Right. The number one important factor of the vaccine is to prevent you from severe disease, which is hospitalization and death. That's the number one goal. Right. The secondary goal of preventing infection and just getting sick and feeling poorly is a secondary goal. So the question is, how do you achieve that goal? How do you achieve that number one goal of not dying or being hospitalized? And how do you achieve that secondary goal of not being infected to begin with, right? So the vaccines it stimulates your body to produce antibodies to fight the virus, so that if your body were to come in contact with that virus, you have the necessary antibodies, basically soldiers ready to fight because they can recognize the virus coming in and beat it back. So when you complete your vaccination series, after you have your second shot, essentially you have boosted your immune system to produce the necessary soldiers, right? Now, with some vaccines, not all vaccines, but some vaccines, over time, those amount of soldiers that are around can dissipate, and they can dissipate and go away if they never have to fight, right? It's like having 50,000 soldiers who are constantly at the wall. 20 years later, okay, we've never had to fight a single battle. All right, yeah, some of y'all can go home, right? Just as an oversimplification. So if you keep sending some of them home, eventually you might not be able to produce the right amount of soldiers to fight if they come that fight that virus when it comes time around. So the thought is that, okay, those antibodies, those soldiers that fight the infection, they're dwindling over time. You know what? We need to do a booster again to boost your immune system to produce more. Now, what you're hearing in the news about the about the booster shots or about those who are immunocompromised. So you're talking about patients whose immune systems are already suppressed. So even though they completed their vaccine series, they don't produce as many soldiers to fight the battle as someone with a normal immune system, right? So I have a normal immune system. I can produce 100,000 soldiers. Someone with a suppressed immune system might only be able to produce 50,000. And if it dissipates over time, well, now they need a booster shot to get up to that 100,000. So we're fighting the same battle. And that's what you're hearing about in the news. Now, we don't know yet if everyone who doesn't have an suppressed immune system will need a booster shot, right? They think it might happen. They think it might not, but we need more time. But that's to say, I mean, think about the hepatitis B shot, right? We get vaccinated for hepatitis B very young in life, but they retest you again around your early 20s to see whether or not you still have those soldiers fighting for you. Transplant patients, thank you, Tina. Those are some of our immunocompromised patients that you need to check. You need to check to see whether or not they still mount a response, right? Because that those soldiers can they can go away over time. And that's what you're hearing. It's not that it didn't work. It worked. It did exactly its job. But you have soldiers sitting around doing nothing. Sometimes they go home, and you need to boost your body to send more soldiers out to fight this infection for you.
That's a perfect segue. What we'll do now is we're going to take a quick commercial break. And on the other side of this, I want to come back with Dr. Fitzgerald of more of that global perspective and what you were seeing there relative to our conversation thus far and leading into this booster piece. Because some haven't even been able to get the original vaccine. Let's talk about the importance of that. And then we'll circle back around with Dr. Schuster. I ask you to jump back in from that, from the perspective of having these young ones, in terms of the 2.5-year-old in particular, from the parent perspective. So again, our viewers, thank you for joining us. We are having, again, our conversation around this Delta variant in and around our communities, in particular our Black urban communities, with our young people returning to school and in other public places. So you're here live at the Seat at the Table, hosted by yours truly, Karl Singleton, talking with varying doctors around the COVID-19 Delta variant. We'll see you on the other side of this commercial. Thank you. All right. Hello and welcome back. We are here again having our conversation with various doctors addressing the Delta variant. Before we left, we wanted to jump in, have Dr. Fitzgerald jump in and talk about that global perspective based upon what we've discussed thus far. So at this time, if you would, please.
Thank you. So I think one of the biggest things that we encounter is that in the Black community and other minority communities, access is a major problem in terms of just exposure to healthcare. And then not only the access, but the quality of it in general. So in some of these places in other countries, access is not available because there may just be one hospital to provide healthcare for an island of 50,000 people. And then when it comes to the providers, obviously with one hospital system or, maybe two, you're looking at people who are responsible for taking care of an entire population, and the whole concept of burnout and just being overworked and run down, especially when you have patients who don't necessarily get regular health care. So they come in pretty severely ill. And so I think that's one of the things that I have been privileged to see and further learn how to understand. And I think there are lots of doctors who do this kind of work and try to go and provide some sort of assistance and offloading some of these issues so that the providers on these islands stay on the islands and, in other countries and continue to provide quality care. The other issue is government funding from the standpoint of just not necessarily having the wealth in a particular nation to provide access for all of those people and having different types of insurance systems and things of that nature. So it's been a very eye-opening experience through a pandemic to see how other places have been struggling to accommodate the needs of these patients. And then in terms of education, they're still not necessarily on the same page as we are in the United States. And even we were extremely slow to catch up and understand how to best accomplish this and how to continue to keep our nation safe. I mean, going back to what was stated earlier, a lot of people have lifted the laws for masking for vaccinated people, but you can't prove who's vaccinated and unvaccinated on a day-to-day basis. When you walk into a grocery store, nobody's checking to see whether or not your vaccination card is with you and whether or not you've had both of your shots. And a lot of people who are anti-vaccine are the people who didn't believe that COVID was going to turn into this mega pandemic in the first place. So the reason why it's starting to pick back up and it's spreading the way it is most likely because of the fact that the people who were never on board with all of the rules and regulations were probably some of the first people to go back to not masking, not using hand sanitizer, not feeling like they needed to wash their hands, and wanting to be in these public spaces and not respecting space. So that's one of the challenges I think that we're facing right now.
Yeah, thank you for that. Long before the pandemic, unfortunately, there was people who didn't believe in hand washing, etc., as we very well know. I see one of the things that I did, and we'll say apolitical. I don't know anything about politics, but I do see where some certain social media platforms has started to go after even elected officials on the federal level for spreading false narratives, we'll say, around masks and whether or not they're effective or not. We saw a recent case of that on a national scale with Senator Rand Paul, which I'm not asking you all to comment on. I'll do that part. So I'll say that. But I think some of the best testimonies, unfortunately, have come from those non-mask believers. In which point, whether it's Fox News or MSNBC or CNN or others, they're actually showing these people that are on these ventilators, struggling to tell their stories, not knowing if that's going to be literally their last breaths, but willing to utilize that space and that time to talk to others who are unvaccinated or maskless, out here to consider, the other option, which is to mask up, which is to become vaccinated and to believe in the science overall. So I was saying, Dr. Schuster, I wanted to go to you next, just to have you jump in at this point.
Yeah, so one of the things that I have been kind of trying to educate my patients as well as my own family members is on not believing the hype. And when people initially hear me say that, they think I'm going to say that, oh, COVID's not that serious. But what I mean by not believing the hype is don't believe all the stuff that you see on social media. Don't believe, what your neighbor is saying that you don't need the vaccine. I have seen it firsthand. I know not only, we talk about deaths from COVID a lot, but COVID has had such an impact on mental health for adults and for children. We are seeing an astronomical increase across the country in people that are depressed and anxious and require mental health care. There was a question in the comments about why, did we ever stop masking up in the first place? And I personally went through my own extended family and just tried to explain to them, no, you need to keep wearing your mask. This is a virus. We know that if you're vaccinated, you may not necessarily get sick, but you can transmit the virus. This was not new science. And so when people decided that those who were even wearing a mask wanted to throw their mask away and head out to the local store, I was just so upset. So, if it's one message that I want to make clear, do not believe the hype. Do not think that, we're in the clear. Do not think that, your children going back to school and mask being optional is a good thing. Do not think that the conspiracy theories that, I was vaccinated, like now they're telling me I need another vaccine. There's a reason behind it. There are people working 24/7 on the science behind this. A lot of this information was not new. We talked about the mRNA. This wasn't new. We know how viruses are transmitted. We knew about contagious viruses. I just want to urge people, stop listening to folks who just want to talk, and protect yourself, protect your family, protect your children, because not everybody will die from COVID, but it is such a devastating disease on multiple levels. People can't work because they're home trying to take care of other people, or because the business had to shut down, or because they got COVID and they were fired. That has happened. So, I just urge people, listen to experts. Stop buying into this hype of, oh, we're good. No, we are not good. And those of us who have worked with patients, we knew that there was a potential that we would be back in the state that we're in, seeing an increased number of cases, seeing increased number of hospitalizations, seeing people dying, increased numbers all over again. It's tragic. I think that it was preventable. The message that we started off with from the beginning wasn't great. And so I just urge you to take matters into your own hand and listen to the experts. They're called experts for a reason.
So let me ask this. So, and this is open again for anyone. The CDC, so it's under a trial piece. It hasn't been mandated. It meaning the vaccine has not been mandated by the CDC. And I still want to believe there's good people out there, just maybe ill-informed in certain areas. So maybe I've heard several things with Dr. Fauci as well, talking about the goal in his mind is to have the CDC make this mandated by the end of this month, possibly, as schools begin to fully reopen, etc. And maybe, hopefully, not only maybe, but hopefully, once the CDC is in their true leadership, apolitical position, now that they're allowed to be, make something mandated instead of just recommended. Maybe it'll take off a little more. Maybe it'll have more oomph, or be more believable for those individuals that are out there. And then maybe that's my wishful thinking. But yeah, anybody go ahead, have at it. That's just my little bit of doctor knowledge, my expertise right there, by way of Fauci.
So I wanted to jump in because it's FDA you're speaking of.
FDA.
FDA. And so emergency use authorization is still where we are, right? So I do have an issue as well, but there are with the fact, and I'm just going to say, and my colleagues who are actually in the hospital, forgive me if this is not your take, but I find it difficult, as much as I'm on this panel and am lending my voice to encouraging vaccination, I find it difficult to hang people's livelihood on an unapproved vaccination. It's authorized. And so to his point, your point, once it's approved, then maybe so. But here in Metro Atlanta, these nurses are already talking about, well, I guess this is going to be my last month. I worked in the OR last month with a gentleman said, I said, oh, it's nice to meet you. Nice to work with you. He said, yeah, I guess I won't be working with you long, because of one of the hospital systems that I work in. And they're making it mandatory. I do think, though, remember, there are 90 million. I think that's the latest count. 90 million adults who are eligible, who have not even received their first dose of the vaccine. So what percentage of those 90 million are really just holding on and waiting on that? Maybe we'll get another million. I mean, I don't think that that's going to be the end all.
Yeah. See, I was just wishful thinking. Oh, go ahead.
No, sorry. So I completely understand where you're coming from, that it's emergency use authorization only. So I completely understand. However, the FDA is thinking about approving it, so I agree with you that there's missed messages, right? It's emergency use authorization, right? So that is definitely the label, but the FDA, I don't. Granted, I've never worked in the FDA. I don't know about why they haven't gone further, but they are thinking about making it, saying that it's official. It's an official treatment, right? We have official treatments for COVID, right? A lot of our, like for example, remdesivir and dexamethasone, right? They're FDA approved for treatment, right? For some of these things. Sorry, not remdesivir, but they're FDA approved for treatment for COVID. Now, if we get the FDA to approve, these vaccines, then I think you have a little bit more, more people that you will convince, right? This emergency use authorization for actually FDA approval. I think that will go. I do think that would go a long way, in terms of getting more people vaccinated. But to your point, right? You're talking about 90 million people. How many does that convince? I don't know. I don't know.
Yeah, and I'm just.
I
Okay.
I was just going to say, I have my own practice. I have, there's 7 of us who work here. I have 6 employees, 6.5, if you will. And I just decided I wasn't going to mandate it, but I just strongly encouraged. And so I'm happy to say that everyone has been vaccinated. And some of them were slow to join in. And I actually hired a new MA. And it wasn't until her first, like the end of her first week, maybe beginning of her second week, I saw her, out the corner of my eye in a patient's room, and her mask was hanging down under her nose. And I kind of made a little comment like, I'm sure hope you're vaccinated. She goes, oh, no, I'm not. I was like, oh, and I hired you? Wait a minute. So what I did, so I'm not going to fire her. I just hired the lady. So I pulled her aside and I explained why I thought it was a good idea. I did not put her, her livelihood on the line. But honestly, and I guess I'll tell her business. But honestly, she had a fear of needles. So we have to be careful that we're not attacking everyone.
Yeah.
I kind of went off the other day. I did a live the other day just because I was just kind of at a point of just my high level of festivity, like I like to say. And I decided to go on a live, not on my business page, but on my personal page, on my downtime, my lunch hour, and speak to how selfish I felt like other Americans are not, caring for their neighbors, and you're not doing what God told you to do according to the word. And, but then I did think about, what if it's a fear of needles? And someone came on my live and replied and said, I agree, but I disagree, because this particular person stated she knew 2 people that within weeks of their vaccine, they died. I didn't bother to go into maybe she was, they were already, I just gave the condolences, but I don't know this person personally, but this is part of the reason why this is exhausting. Because Dr. Iffy and Dr. Angel, because she's in the emergency room, and oh my gosh, Dr. Fitzgerald, I'm sure down in the Virgin Islands that had to have been tough. They are like, y'all are frontliners. Like, I am just in the background trying to encourage. And just today, the reason I'm still here in my office, I'm on ER call today. And I had to go into our emergency room. It was a zoo. It was like a war zone. They have the beds are lined up in the hallway. And I'm like, what is BH04? Oh, bed hall 04. Y'all making up rooms. And my hospital, it's a small community hospital. We only have 130 something beds. And at our height in January, we had 75 COVID patients. And we, like you spoke of earlier, had dropped down to single digits until most recently. Now, as of today, we have over 50 patients. I don't know how many are in the ICU. I don't know how many are intubated, but yeah, this vaccine, we have got to take the time. And I was just going to say the burnout is coming in different aspects, because I have to muster up the energy to go into the next room and still have that conversation, because I feel like it's my job. I can't say, let her do, let her be whatever and do whatever she wants, because there may be a valid concern. There may be something in her history, her mama's history, her medication history that warrants more conversation. So I hope we all, we're not a part of the burnout crowd, but we have to learn to take care of ourselves. We know that we talk about self-care, but this is a difficult journey, and it is a marathon.
All right. So on that, what I wanted to do is interject, because I promised you all 1 hour. And I don't mind stopping here because, of course, I'll be calling again. You won't be burned out. I'll keep encouraging you all and everything. But what I wanted to do is make this formal announcement. We did it with one of our other segments, but we're starting something here. And thanks to our sponsor, Mid-Penn Bank, we are starting to recognize our Black Excellence Beyond February, 365, 24/7. I want to let you know that this panel is going to be the second podcast that we recognize as that. So you all, I just want to let you know how much I appreciate and value not only your professionalism, not only your attention to detail, but being Black professionals, Black people in America who knows you're Black people in America. And we clearly understand that it is not February, but as our segment says, we are celebrating Black excellence beyond February, 365 days a year, 24/7. So thank you for being a part of it and being recognized as some of many of our Black excellent professionals that we are going to be dealing with and engaging with as we continue our podcast. So with that, I'd like to ask that you give closing remarks. Take some time to close out. I would like to just start off by thanking you and also inviting you to participate. Most of you probably already received the email, but we meaning the Pennsylvania Diversity Coalition, we are hosting Equity and Inclusion State of Black Pennsylvania Summit on Wednesday, September 8th from 8:59 a.m. until 2:59 p.m. at the downtown Hilton. And you all, of course, are welcome to be panelists if your schedule lends itself with the health field policy, et cetera. So at this point, I'd just like to turn it over to you all. And thank you again for joining us. And if you wouldn't mind giving your closing remarks. And we'll start with Dr. Fitzgerald, please.
Thank you again for having me on the show. I really appreciate it. It's always been an honor to be on such an amazing panel. All I can say at this point is that I would encourage everyone to address the real fear that is underlying your hesitance to go forth and get vaccinated. And also allow yourself to be informed. Take a look at what's going on in the world around you, not just next door, but globally, and see how our communities as a whole have been affected and how it could potentially affect you. One of the things that I strive for is to be a voice of reason whenever appropriate, and also be a sounding board. So if there are any issues, I'm always happy to have that conversation, but understand not every healthcare provider is going to be negative or have that same intrinsic hatred or concern that the Tuskegee experiment brought to our community. So understand that there are some people who are allies and advocates, and we want the best for our community. I think everybody on this panel is tired of seeing our Black and Brown folks dying from something that could potentially be preventable. So thank you again.
Thank you. Thank you very much. Dr. Schuster, please.
So I'm just going to, as my closing statement, reiterate what Dr. Fitzgerald just said, and I might even steal that as my next motto. But please, just allow yourself to be informed. I absolutely love that statement, and that is the message that I have been trying to get across to my families and their children who are old enough to, understand what's going on. As well as like my own family members. I think that it's such a great statement. Allow yourself to be informed. I think that that is the best thing that you can do. Listen to the experts, listen to the science. Again, don't believe the hype. We were told in the media that we were doing better, but there were so many of us who behind the scenes were like, no. And there were so many of us who were like, why are we not wearing masks? Why is it even a question for those of us who are sending our children back to school that they're not wearing masks? So we are here to take care of you. And we are also people. We are also going through it on a very personal level. We are your allies, and that's why we're here tonight, because we care, and we just want to spread the message. So again, thank you for having me.
Thank you again, as always. Dr. Burke, please.
Sure. I think I'm just going to leave with this as I started off. This has been a very tiring day today. At 10 o'clock, I got a phone call from the nurse at my son's school that he was identified as a close contact, meaning there was a known exposure kid in his class on Tuesday who is positive, and positive because there's a family member at home. And that family has chosen to send their child to the school maskless. And I'm just going to tell you, protect your loved ones. Don't be on Don Lemon's show, in a week, at the bedside with somebody holding, the oxygen to your mouth, and you're almost taking your last breath and saying, what I wish I would have, should have, could have. Even if your school districts, even if your schools are not mandating, if your job is not mandating, if Walmart takes down their signs, advocate for yourselves. Love yourself enough to mask up. Definitely vaccinate as well, but stop trying to play and, oh, well, the CDC says, and I'm not down. Just mask up, protect yourselves. I don't see enough people washing their hands like I used to. People are not as diligent with the hand sanitizer. I need those to fly off the shelves somewhere, okay? So let's not get weary and well-doing, and protect ourselves and our loved ones.
Definitely. Speaking of that, hand washing and et cetera, there's a coalition member that pushes skin tech, Tanya Lawrence, that I like to highlight. And I'll have to get her on the show, and she'll talk specifically about certain things. And I'll introduce her to you, definitely, Dr. Burke, because she has this product that we believe is phenomenal. So definitely that came to mind while you were speaking. So Dr. Nduku, please, sir, round us off. You knew you were going to go last.
I didn't, but okay. So I think, so one, thank you for inviting me. I think this panel is absolutely amazing. I've actually interacted with everyone on this panel multiple times before, and I always enjoy talking with them. So insightful, every single one of you. And so it's hard to follow up all that great advice. So I'm just going to echo and parrot what they said. You really need to try to get educated. And if you have people who have doubts, and I don't chastise them, don't yell at them, but just try to ask them questions to understand where they're coming from. And then once you try to understand where they're coming from, why they feel the way they feel, if they have reasons for them, then try to point them in the right directions for someone who can answer those questions, someone who can provide the right information, someone who can educate them appropriately with legitimate facts. And wear a mask. As I'm seeing these numbers come into the hospital, and I'm seeing what their trajectory in the hospital looks like, it's not pretty. It's not fun. And the worst part about it is lonely, right? Because if you have COVID in the hospital, your family members can't visit you in the hospital. It's a lonely way to be sick. It's a lonely way to have a disease. And unfortunately, it's a really lonely way to die. So I'm not trying to be morbid. I'm not trying to be morbose. I'm simply trying to say, try to get those around you vaccinated if you can, and wash up, wear a mask, wear your own mask around when you're in public, wash your hands. I keep hearing and seeing with all these concerts, oh, we beat the pandemic, we're over the pandemic. Clarification, the pandemic is still happening. We are still very much in the thick of it. right? We've made progress. We have a vaccine faster than anything in recorded history. We have a good chunk of the population vaccinated, but we're still in a pandemic, and it's not USA isolated, it is global, right? So when you hear that, will we beat the pandemic? No, we're still in a pandemic and we're making progress, but we got to keep making progress to truly beat it.
All right. And I have 0 to add to that, aside from the state of Black Pennsylvania, which you are all welcome to be a part of, will be held on Wednesday, September 8th from 8:59 a.m. until 2:59 p.m. at the downtown Hilton here in the capital city of Harrisburg. And with that, I will thank all of you. Again, shine the bright light on you all as being recognized again. Thanks to our sponsor, Mid-Penn Bank, as our Black Excellence Beyond February 365 24/7. With that, I'll just ask Dr. Burke to hang on because we're going to talk a bit about the Harrisburg High class of 1991 30th reunion coming up. And we're also going to bring on Miss Stephanie Mitchell, who is another classmate of ours. Okay, so it's 30 years for me as well. So we're going to talk about our robust Labor Day weekend that we have planned to celebrate our 30th class reunion. So again, thank you, doctors, for joining us. And I'll be reaching out to you. As always, we ask that once this concludes, if you wouldn't mind jumping into the comments section later this evening, right after the show, and or tomorrow, just to see if anyone had any additional feedback and or questions that they may have proposed to you directly. Feel free to stay engaged that way. I'll be talking with you all soon. Thank you again for thinking it not robbery to help us have this conversation.